Tinaa is part of the patient safety improvement team with a special interest in venous thromboembolism, and she describes how she and her team created patient information specifically for patients with learning disabilities. Thanks, Jo.
Disabilities and dementia to understand. It's quite simple, really. You just need to make it easy. So what is accessible information all about? Well, it's mandated in the Accessible Information Standard, which says that people should be able to get information in a way that's easy to understand for them. And NHS England works with people with learning disabilities to ensure that this is appropriate for the audience. I worked with a learning disabilities nurse, and she was able to guide me through this process. Our learning disabilities team is made up from a nurse and also from another employee who has a learning disability. And the team was very valuable in giving me feedback for the booklet that I made. There are lots of different ways that we can make information accessible for our learning disability patients. And sometimes it involves thinking outside the box a little bit. So let's look at some of the ways in which we can do this. So we show hard words in bold text. We use simple text, easy to read format in a large font. You can do a film or a presentation, or sometimes just a soundtrack is quite nice so they can listen to it and don't need to concentrate on trying to formulate the words in their head. Talking is always very valuable as a tool, and as you know, NICE guidelines recommend that all VT information given is given with verbal support. We can also use social media and pictures to get our message across. But one thing that I do know is that this information, however we choose to do it in an accessible format, should be made available for all of our patients. When developing our accessible information, we need to think about the main areas of information that people need to know. For example, I mirrored the existing VTE leaflet and stuck to the key themes on that leaflet. We need to say things simply, using big writing and a large font. Short sentences and supporting what we're saying with pictures is a good way of getting the message across. Get rid of difficult words. Is there another way we can say it? Can we say it in a simpler way? Using bullet points is sometimes a good method of saying things in a simpler way because it removes unwanted words and keeps the message short. And always check the words with people with learning disabilities. I'm lucky in my trust that we have a good learning disabilities team that are able to help me with this. And they checked my leaflet before it went into the printing stage. This means that it's meaningful and understandable by the audience that it is made for. This is my leaflet. I've used a picture of my trust on the front of the leaflet, and this means that the patients who are looking at it knows that it's relevant to where they are at present. The inside of my leaflet looks like this. As you can see, it looks really short, but the key points are still there. So I've told them what a blood clot is. I've supported this with pictures and tried not to use any really graphic material. Of course, we don't want to scare these patients. I've told them the signs and symptoms of blood clots, again supported with pictures. I did find that trying to show somebody who's got chest pain or short of breath in a picture was quite difficult. We've then gone on to say, this is what you can do to help yourself. So we've talked about keeping moving and drinking plenty of water. This is where the verbal support of our nurses admitting comes in. They need to tell the patient whether they can drink, of course. And if there's any difficult words, they can support them with this. As you know, NICE guidelines say that the information should be given on admission and discharge with verbal reinforcement. So by a nurse talking this through with the patient when they give it to them, it should get the message across in an understandable way. I've talked about injections, and I thought it was quite important to show a picture of a needle going into the abdomen. They need to know that that is what's going to happen, that it will go into the abdomen and that it may sting a little bit afterwards. I've also talked about anti-embolism stockings. Although these aren't widely used in medical patients, there may be an occasion where a patient has come in with some bleeding, and then in that case, we do still use anti-embolism stockings in my trust. I've warned the patients that these may feel tight on their legs, but this is normal and it means they're working. And in my last section, I've told the patient where they can go for help once they've left hospital and what to do if they think they've got a clot whilst in hospital. These are the references where we got the information. I would highly recommend that if you are going to develop this in your area, that you use the resources in your hospital and that you use your learning disabilities team if you have one, or perhaps a dementia nurse, and they can guide you on this. This information is also available online, and there is a user guide on how to develop this information. Good luck. If you have any questions about this presentation and you would like any help or support on how to make accessible information, please contact me on the email address shown here. Thank you for listening.